Back on this Saturday morning, Sports Medicine Weekly, Chicago's premier sports medicine program. We come your way each and every Saturday between 8 a.m. and 8:30, only on 670 The Score. To access prior shows, interviews, and valuable resources on sports injury and fitness, please visit our blog at smwhome.net, or the website is sportsmedicineweekly.com. Steve Cashel with Dr. Brian Cole, our producer, and board operator is Shane Reardon. Time now for our Ask the Doctor segment. Always fun doing this segment. If you want to be involved and ask Dr. Cole a question, it's very easy to do it. Go to our website, sportsmedicineweekly.com, and on our homepage on the right side underneath the picture of Dr. Cole and yours truly, you can click on that link and ask the doc a question. Dr. Cole, you ready to go?
I'm ready. Let's continue my office from earlier in the week.
Yes, sir. Question number 1, all right? While using the leg press machine at my gym, I hurt my knee. Pain is primarily on the right side, but also within the knee when I place weight on it. Subsequently, it feels like I have pulled a hamstring muscle and have a tender Achilles as well. Some other things. Initial injury took place about 2 weeks ago. Achilles is feeling better. Hamstring still sore, but slightly better. Knee still tender. Here's his question. Any thoughts on what could have happened?
Well, I think this just begs the larger question: when is there a significant injury that really is something that has to be tended to rather than ignored? So a leg press machine is a closed chain exercise. That means when you push on the plate, you're contracting your quads and your hamstrings at the same time. That's a lot better machine than the other one you often see in health clubs and gyms, where you put your tibia, your shin bone against the machine and you sort of extend your knee. That's probably one of the most archaic exercises, because that's an open chain exercise that loads the patellofemoral joint, the kneecap joint.
Yeah.
So it's amazing they still have those in gyms, but it's just one that you kind of stay away from. So there's a difference between what we call open chain and closed chain exercise. So the safest and most efficient one, if you're working out, is going to be a closed chain exercise. That means where you're simultaneously contracting the muscles in the front of the leg and the back of the leg at the same time. So that's if you're pushing something, right? Same thing if you're doing a squat, a short arc squat on a rack and things like that, versus one where you do a straight leg extension. So does that make sense to you, Steve?
Stay away from the leg extensions.
Right. You can get the same muscle group, but you can get them at the same time, the front chain and the frontal chain and the posterior chain.
Yeah, why not?
So in this particular instance, obviously this gentleman is saying, look, I have pain on the right side. I don't know if it's his left leg or his right leg, but I think it just highlights the issue. What would be significant? If you're using a weight machine and you develop the acute onset of knee pain, and it's along the joint line on the inner or the outer side, and it swells, that more likely than not is something that's significant. Swelling is definitely a sign that you have done something. Now, you can choose to sort of wait it out for 24, 48 hours, maybe take anti-inflammatories over the counter, ice it, and so forth. But if the knee is a locked knee, you can't bend or straighten and things like that, that's more of an orthopedic emergency. The sudden or acute onset of knee pain, I always tell patients, I say, look, if you didn't get into my office right away, there's a good chance in 5 to 7 days this stuff's going to get better on its own. So patients need to know when it's serious and when you should actually seek treatment if something happens in response to exercising. And I would say the key findings are loss of motion, acute loss of motion where you can't bend or straighten the joint, very severe discomfort, the knee or the joint goes out of position in some way, acute numbness, tingling, things like that. Those are more emergent type situations. I can't say what this individual did. My guess is nothing serious, and probably by the time I got to answering this question, they're feeling better. So I think the things that are to watch for, as I described, acute onset of swelling, significant pain, motion loss, those are things that require more immediate attention. Lots of these other things can take a little time and will get better just by what we call skillful neglect.
All right. Question number 2 in our Ask the Doctor segment here on Sports Medicine Weekly. This is a quick 7-word question for you, Dr. Cole. Is recovery nutrition post-workout food important?
Yeah, so I think the thing is, look, if you exercise to tone up or slim down, you got to really make sure that you really need a, quote, recovery meal before assuming you do. You want to obviously maybe avoid things that are hyperglycemic, that give you elevated sugars due to glucose and simple sugars and so forth, and fire off your insulin. So I would say that the unfortunate thing is that many people actually overeat after working out and actually consume more calories in their post-workout recovery meal than they've actually burned during their workout. So we sometimes feel like we get a buy when we exercise, say, okay, I just worked out, I can just eat whatever I want. And I think they end up having positive calorie intake rather than actually being more efficient in that way. way. So look, if your workout is not more than, say, 90 minutes or completed at sort of a sweat-soaked, high-intensity rate, which we probably want to do a couple of times a week, you may not really need a true recovery meal or a snack after you're done. So I think just keep in mind a healthy snack, fresh fruit, veggies, maybe hummus, drink of water, maybe something like a lower-fat chocolate milk, things like that for good replenishment. But you don't need to have a carb-heavy, I just exercise, I get to make up for it, and then some meal for recovery. The one thing is that, we do have problems with delayed onset muscle soreness and things of that nature, and that can be due to muscle breakdown. And that's where recovery involves proper protein intake, which includes what we call essential and branched-chain amino acids. So an aliquot of protein is probably just as important as anything during the recovery process because of muscle breakdown and to maybe minimize the onset of delayed onset muscle soreness.
And I would imagine stay hydrated, right? Water is always good.
Yeah, it's key. Pale-colored urine is sort of your surrogate for whether or not you're properly hydrated. But I would say at more than anything else, staying properly hydrated is going to be important after a tough workout. Take advantage of all those calories burned, and having an excessive recovery meal probably doesn't make a whole lot of sense.
All right, it's our Ask the Doctor segment here on Sports Medicine Weekly. I'm Steve Cashel with my co-host, Dr. Brian Cole. And I've never heard of this. Here's question number 3, Doc, for this segment. What is cord blood banking?
So cord blood banking is a rather entrepreneurial business that's been around for some time. And basically there are a number of these sort of blood banks, if you will, that are certified that you can take umbilical cord blood, which would otherwise be probably thrown away with the placenta, and at the time of birth. And there are lots of wonderful stem cells present that are what we call pluripotential. They have the opportunity to differentiate into different tissue types if placed in the right environment. The challenge is that the diseases that it can treat have been still poorly vetted and are somewhat experimental. And the real application, which we had hoped would be for diabetes, for other immune diseases, things of that nature, there hasn't been a large number of diseases that can be treated with these stem cells. So they ultimately would have to be cultured, expanded, and useful for some disease states. So it's a burgeoning business based upon some hope that in the future this blood could be thawed, used to treat rare genetic diseases and cancers and things of that nature. But the reality is we haven't really identified a large number of these. I will tell you, even in orthopedics, I've had a number of patients who have come in and says, look, I have access to cord blood from A, B, and C. First of all, it has to be a match. Second of all, it hasn't yet, the use of stem cells in this capacity to be truly regenerative, say for traumatic brain injury or spinal cord and things like that, is really in its infancy and is highly investigational. So we have a long way to go. I would say if you're going to do it, there's no risk, but there's a cost involved. So you want to ask all the hard questions. And frankly, I don't know what I would do in today's day and age if I would actually consider doing it. I would want to have a little more assurance that it has some true anticipated benefit in the near term.
All right, one more question here in our Ask the Doctor segment for Dr. Brian Cole. Here we go, Doc. We've got another question from one of our listeners. If my muscles are sore from previous workouts, is it safe to exercise them?
So this is a condition called DOMS, or delayed onset muscle soreness. It usually happens in the first 1 to 2 days, and it's largely due to microscopic breakdown of muscle and protein. And it's really why adequate protein intake is so important. Recovery can be mechanical, foam rolling and soft tissue procedures and things of that nature. It can deal with cold contrast bath, things like that, massage and so forth. But it also requires adequate nutrition. So it's usually a sign that there's some microscopic breakdown. There's some data that shows, for example, that taking creatine at the time of workout in the proper doses can minimize this. But the bottom line is it's not necessarily dangerous, but you really do need to give yourself some time to recover because it'll put more stress on the other ligaments, the tendons, and maybe increase your chance of injury. So I think that avoiding this concept of overreaching, which is really training beyond what your overtraining, beyond what your threshold should be, proper nutrition recovery. Protein intake is really important, and I would respect the muscle groups that are very, very sore and probably consider cross-training and working on other non-sore muscle groups in an effort to get the most efficiency and the most out of your workouts.
Great stuff. We're out of time. Many thanks to our producer, Shane Reardon, our coordinating producer, Teresa Ann Seeger. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopaedics at Rush. For Dr. Brian Cole, I'm Steve Cashel saying so long. Thanks for listening to Sports Medicine Weekly here on The Score. Up next, Early Odds with Joe Ostrowski. Take care. Talk with you again next week, everybody.